Assalamu alaikum. Okay, I'll try to stick to English, but I don't have much knowledge about English. So first of all, I must say that there is a little bit change in the title of. Mostly, I will be talking of the past and present. Future is something which I think audience will be trying to. I will involve them, and I'll try that their views should be added from past to present. That's the progression of nuclear medicine in Pakistan, and what should be the future. So we will talk about that. So layout is like historical perspective, overview of the current status, what are the challenges we are facing, opportunities and areas of growth will be identified in there, and now emerging technologies which are there in the world, and what technologies are being introduced in Pakistan nowadays, and what will be done in future. We have got research, education, and then we have got initiatives from the government, and then international inputs. So if we talk of nuclear medicine center, it was first center was laid out in Karachi back in 1960s, and this center was having a rectilinear scanner, a few like counters, survey meters, and that was all. And that is 1960. Now we are 63 years down the lane, and as I will explain that Atomic Energy took the initiative to build this center. Initially, there was no such center in the private setup or the provincial setup. Only Pakistan Atomic Energy, with the help of IAEA, was establishing these centers. This is an older picture of same AEMC, Atomic Energy Medical Center, that was renovated or upgraded along with radiotherapy facilities somewhere in 2006-7. If we talk of the private hospitals which took up nuclear medicine as one of their specialties, it came in 1993 in Karachi. So you can see a large gap, 1960 and 1993. That is 33 years. Here I was told, I have never visited this facility, but I am told that the first gamma camera in private setup was installed here. What is the current status? If we count in all how many nuclear medical centers are there in Pakistan, we have got 50 of them. And out of these 50, Pakistan Atomic Energy Commission has got 20 established and running facilities, while one is under construction in Azad Jammu Kashmir. In public sector, we have got 18 of them in, I should say, in the provincial setups, and then we have got 12 in private. Among these PET centers, they are like 12. It is quite, I'm surprised. Most of them, they are located in Karachi, I believe, because first center, I will explain later, was established in 2009, and second was established in 2010. So after 12 years, 13 years almost, we have got 12 of them. So 10 were added in the last 10 years, and that's quite commendable. So cardiology setups are 9 in number. That's quite promising again. But as I'll go down my presentation, I'll show that there are still deficiencies present in our setups. 15 SPECT CT and 58 SPECT only gamma cameras are available. When I started, there were like only single head gamma cameras, static, without computers, and they were like films, etc., etc. That time is now gone, and I believe that with hybrid technology is there, and it's growing, and it will keep growing, and even that SPECT only gamma cameras will be gradually phasing out. So this is this current status of nuclear medicine in Pakistan. These are the atomic energy cancer hospitals, not the private ones. We have got one in federal capital Islamabad. In Punjab there are 7 of them. In Sindh there are 5. KPK it's 5 again, Balochistan only in Quetta, and there was recently established in Gilgit, that is in the northern part, a beautiful part of Pakistan. If you find a chance, do visit this area. We have got a big hospital plus a very beautiful place. Latest addition to our setup is DCN, Diagnostic Center of Narowal. They have got little bit radiology, a nuclear medicine facility, and clinical labs. We talk of the world. According to IAEA, this is the figure taken from a Lancet publication of IAEA, I believe. They show that there are like almost 1400 institutes all over the world, and university based, non-university based, private and others. Nuclear medicine is something which is difficult, it is expensive, but as you can say that university based hospitals are the maximum number all over the world anywhere. We are not getting the data from Europe, Western Europe, and from Canada and America added to that. We are talking of like South America, Africa, Eastern Europe, Asia and Oceania. We are not even talking of like Australia. Their facilities are, I believe, that much more better than the rest of the world. But still, if we talk of all these countries, only 1400 institutes of nuclear medicine are available. Among these, talking of Asia, there are like out of 1400, 800 are present in Asia, and they have got 656 SPECT gamma cameras, SPECT CT 224, planar only gamma cameras phasing out gradually. I believe that that's true for Pakistan as well. And then we are talking of PET scanners. This is something which is a need of the hour and the latest development in nuclear medicine. So their growth is something which shows that the priorities of the governments, priorities of the oncologists, the ultimate users, priorities of the private setups. So PET scanners and cyclotrons, they indicate the progress of any country. If we talk of nuclear medicine staff, again in Asia, we have got nuclear medicine physicians, about 3000 of them, physician in training 450, medical physicists, again part and parcel of our setups, they are like 387 or almost 400, and the nurses are like 1500. Radio pharmacists, they are like 229 all over Asia, and technologists, they are equal to nuclear physicians. So talking of SPECT scanners per million population in the 212 countries, again as we talk of like Canada and US and Western Europe, there you can see the highest number of SPECT gamma cameras available, more than 10. Talking of the area where we live is Pakistan. This is the country. So here only 0 to 2.5 per million. We have got a population of about 250 million, almost 232 to 50 million. So our number of gamma cameras, I will explain a little bit later, they are not according to the standards which are present in the advanced countries. Now coming to first PET CT and cyclotron was established in 2010 in Shaukat Khanum Memorial Hospital and Research Center in Lahore. We started working on that, but they took the lead and they started having clinical studies in 2009, and we joined them about 10 to 12 months later, and now PET CT at Inmol is like 13 years of age, and they have done more than 40,000 patients up till now. PET CT at Shaukat Khanum contributed a lot. They are adding up to their facilities. They have added one PET CT scanner in, I believe, Dr. Amna is here, if she can. No.
One in Peshawar and
one in Peshawar, one is in another one in Lahore. So there are two of them, and Lahore is the fortunate one, because now we have Pakistan Kidney and Liver Institute, PKLI. Dr. Khalid Nawaz is the person behind the show at there, and they have got one PET CT scanner. There are two of them in Shaukat Khanam, and in Mol is currently having the PET CT scanner of 2010, but soon, I believe in a year time, they will be having another digital PET CT scanner. So the efforts in 2009 and 10 culminated ultimately. So there are 12 PET CT and cyclotron centers throughout Pakistan. Are they enough? They are not. We have got a large number of patients which are on the waiting lines, and they are like asking for FDG, which was initially started. Now we have progressed towards Gallium-68 based PSMA, DOTA, and other new pharmaceuticals. But the thing is that the number of scanners, they are operational like 8 o'clock, 9 o'clock in the morning till 6, 7 o'clock in the night, and still we are not able to complete the requirements. So if overall we see that how many PET scanners are there per million internationally, and then what about Pakistan? We are in the gray area here somewhere, that 0 to 1. So sorry, not gray area. So this is Pakistan, this is Afghanistan. So Pakistan is having something like 0 to 1 PET scanners per million. A lot has to be done in this regard. Nuclear medicine in Pakistan, as I told earlier, that Atomic Energy took the lead in 1960, establishing such things. And initially, they were importing technetium-99m generators from abroad, iodine-131 from abroad, thallium and all the other radioisotopes and pharmaceuticals from different countries. But then gradually in 1980s, the initiative was again taken by Atomic Energy Commission, and they started producing their own iodine-131, and they have started producing their own technetium-99m generators and pharmaceuticals. Although the number of pharmaceuticals being produced at Pakistani Atomic Energy Commission facility called PINSTEC, this is PINSTEC reactor where all these activities are happening. So they are actually going for indigenization in a sustained manner, and they are developing new pharmaceuticals to fulfill the local requirements.
The last 2 minutes of your presentation. Last 2 minutes.
Oh, so P32 was the first one. Lutetium-177, they have worked on that. Samarium was 153 it is. So it was produced for a little while, and now actually they are working on lutetium-177. And because of that, radiation cyanobectomies have been being performed here in Pakistan. Our Peshawar Center, IRNAM, is like at the leading. So theranostic facility, again with the help of IAEA in Mol, Lahore, started the first theranostic lab in 2017. Now these things have been now duplicated at Noori, Shaukat Khanam and Kiran. Kiran is Karachi, Noori is Islamabad, Shaukat Khanam is in Lahore. So far at Mol we have got PRRT, PSMA, and then theraspheres of labeled with deuterium. These are routinely being performed. Lutetium is now being produced we import them from abroad, but indigenous production is going to be started soon on clinical side. So if we talk of our nuclear medical facilities, then we have to understand that according to WHO healthcare levels, we are having this level and not much of this one. And we have to go from this to this level with the help of our governments, from the private setups, and with the help of the professional societies. How many nuclear physicians are there? Again, we lie somewhere here, only 0.1 to 5, and we are far, far behind. My lecture should have been concentrating on what to do about that, but I think I will leave this thing to the audience to understand that how this thing can be done. So this is just a repetition. I will skip this slide. We have got nuclear medicine education from the PIAS, We started in 1988, the MS program was started, PhD was added, total fellows so far passed out of 120. Are they sufficient? They are not. Many of them, they have retired, many of them have left the country, and certain number are still working here in Pakistan. So, and in addition, we have got addition of MD program, 4-year program, in addition to MS 2-year program, and that will be started soon. Nuclear medicine by the College of Physicians and Surgeons was established somewhere in 1998, and first graduate was passed out in 2002. So again 21 years. So far FCPS number of people like 48 of them so far. And if we talk of their roadmap, an MBBS degree is must, house job is must, पार्ट 1 क्लियर करना भी एक बहुत बड़ा काम है जिसमें अक्सर लोग बड़ा घबराते हैं, बट इट कैन बी डन एंड पीपल हैव डन ऑलरेडी. सो देन देयर आर 4-year programs and then they actually appear in the final exams and they become specialists. Ziauddin University in Karachi, they have got MD program. I don't know, I have been told that the 3 to 5 fellows have passed out and all of them they are for the local consumption in Karachi. PNRA is something.
Time is up.
Time is up.
Yeah.
चलो. फिर मैं मुझे आखिरी slide
Go to the last slide. Yeah.
Our society was established in 1995. If you see that the Dr. Saida Asghar was the first person who presided that. My signatures are somewhere here, but this person, Dr. Amir, publication secretary, left our country. Now he's in radiology. Talking of one became radiotherapist, another one still radiotherapist. So Dr. GM Shah, Dr. Saida Asghar, they took the lead and formed this society, and up till now. So we have to encourage nuclear medical education. We have to understand, in addition to nuclear medicine and nuclear physicians and physicists, we have to have technologists, we have to have pharmacists. And I believe that this forum should be used to encourage government as well as people to come to this specialty. So 1995 and now 7 conferences been done and 8 is in progress. We have got our own journal. So here I think with the help of international collaboration, national liaison and international meetings, we can achieve what is required of us. Thank you.
Thank you, Dr. Ahmed Qureshy.